very warm welcome to my channel. I especially made this channel in COVID times to educate people. I'm Dr. Akanksha. I practice in Jharkhand. I have been working in COVID for a year now, almost a year now, in ICUs with ward patients from mild to moderate to severe. I've seen all kinds of cases. So, because I practice in Jharkhand, so my videos will be specially for people of Jharkhand, but in totality for everybody, especially in India. So, please subscribe if you find it worthy. Like or don't like, it's okay. But do share, because the kind of information that I'm going to share here will help you ease out on many confusions that are currently prevailing in market. People are utterly confused because of some kind of information that is a misnomer or a misinformation, we can say. And because of the confusion, many people are taking wrong advantages of patients, of people who are not properly aware. So I'll begin with it. First of all, in the COVID times, which has again become massive, and the condition is going from worse to even way more worse. Please wash your hands, and wash, just do not sanitize, just do not just sanitize, wash them properly. For washing your hands, take soap in your hands, scrub them, wash the back of your hands like this. 1 2 3 4 5, 1 2 3 4 5. Between your fingers, 1 2 3 4 5, 1 2 3 4 5. Your thumb, your nails, palms, and then wash your hands with water. Then sanitize your hands. Just sanitizing will not help you as much as washing and sanitizing will. Secondly, use your mask, and just don't use your mask, use your mask properly. Your mask must cover half of your face till here. At least it should be till here. Only your eyes and forehead must be visible. It should cover your nose and mouth, and that is a must. Do not, third thing, do not go out in crowded places for shopping, markets, pubs, bar, lounge, restaurants, anywhere that is crowded, malls, anywhere. Governments are not closing such places because of the economic drawback that we had to face in the first COVID wave. But trust me, it is as unsafe and even more unsafe now than it was an year ago. So please do not rush to any crowded place until it's necessary and utmost necessary. Fourth thing, do not, even if you're COVID positive, suppose if somebody is COVID positive, what to do? First of all, relax. Do not panic. You are just COVID positive. You're alive. You're safe. You may be just mildly symptomatic and it's fine. So just relax. You do not have to rush to a hospital just because you're COVID positive. Call your doctor, your physician, and if you're not consulting any physician, there are doctors that are who are providing telemedicine to patients. I am practicing telemedicine to patients. I practice in person with COVID patients. You can always contact me. If you want to contact me, please mention it in comments. If I get some requests, I'll also share my number, my number with which I practice telemedicine. I'll share that also. It's all right. If anybody wants to take consultation from me, you can call me directly, or you can WhatsApp me, you can text me, whatever, however it feels like. But please, please do consult a doctor. Whether it's over phone, whether it's over video calls, whether it's going to the doctor in person and meeting him, if your doctor treats you, if your doctor takes you at this time, please do consult a doctor. Do not rush to a hospital. The beds are full. just because you're positive. If you face any severe symptoms, only then and only then go to a hospital. Get hospitalized and get treated at a hospital. Currently, all the hospitals are occupied. The staff, the doctors, the nurses, everybody is overworked. So, the kind of care and the kind of treatment and the kind of food and everything that you can get at home, trust me, you won't be getting it at hospitals, be it private or government, or no matter how much and what amount of money you throw in, you will not be getting that kind of care right now anywhere except your homes. So trust me, stay home if you're mildly or moderately symptomatic, because somebody who's severely symptomatic may be needing that bed to be alive, to stay human. In times of pandemic, we need to utilize our resources properly. We have enough of resources. All we are doing is not utilizing them properly. Now, how do you know that you are severely symptomatic? Three parameters: check on your temperature, check on your oxygen levels, and check on your pulse. A temperature of 99 degrees Fahrenheit or less is fine. SpO2 levels, that is oxygen levels of 90 and above, are fine. You can be treated at home with an oxygen level of 90%. It is very much possible. You can get oxygen cylinders at home. You can use masks with those oxygen cylinders, and you can easily get treated at home, even if you have any comorbidities like hypertension, diabetes, thyroid problems, uric acid problems, or anything that you're being chronically treated with. Even if you're pregnant and you're COVID positive, you can get negative, better off, asymptomatic, whatever you say, at your homes itself. I have treated patients who were pregnant, heavily pregnant, in the initial days of pregnancy at their homes, and yes, they have been better off. Their babies were born normal, everything was good. So do not panic. Even if you're pregnant and COVID positive, you can still be treated at home if you're mildly or moderately symptomatic. Now, how to use oximeters? Take your finger. It's a small device called oximeter. You put it over your finger, press it. There's a small button over the device. You press that button. Wait for some time, because it takes some time for the machine to read your oxygen levels. Now check your oxygen levels, and also there is a small number that's written below the oxygen level. It's your pulse rate. It's written PR, pulse rate. Also check on your pulse rate. If even if it's up to 110, 120, you're fine. Do not think that you are in tachycardia or your heartbeat has gone very high. No, it's okay. Normally people have a heartbeat of 85 to 90, 98, and that's all right. 100, 110, 120, that's all right. Tachycardia is when you have a heart rate above 120. So you do not need to worry till 120, even 125 is good. Now, thirdly, when we are talking of COVID, we should also be very much aware of the diet, the exercises, the breathing exercises that we should do. I will be talking about these in my other videos. If you want to take any kind of consultation from me, more than welcome. If you want any kind of other videos, or if you want any kind of information, most welcome. Yes, this time it's worse. The viral strain that is affecting us, that is being circulated in this environment, is way more dangerous than the first one. Do not think that you are young and you'll not be affected. I have seen patients as young as 30 years of age die. So yes, it's a harsh, stark reality. We are going through very, very tough times, and this is the time when quarantine and isolation and lockdown was most necessary. even more than last year's. Corona is not on a lockdown. Only we are on an unlockdown. COVID is there in markets, in crowded places, even in uncrowded places. Avoid being near another human being. Just be segregated. I'm not using a mask here. I'm not using a mask here because I'm sitting in a room where I'm alone. Please take proper care, stay hydrated, eat properly, have proper diet, take a good night's sleep, and stay stress free. Also, if you're on any kind of chronic medications like hypertension, thyroid, diabetes, uric acid problems, or anything, take your medications on time. Do not fall sick, because even if you are COVID negative and you have to be hospitalized because of any other reason, it's a very bad time right now to get sick, ill, hospitalized, because there are COVID patients everywhere. Every hospital is a COVID hospital, be it government, private, anything. Take good care of yourself, your family, your loved ones. And please share this video with as many people as you can. Please pass on the information, the message. Please pass on the awareness. Do not take medications without prescription from a doctor, because I've also seen right now in the current situation, everybody is a doctor in society. Everybody's prescribing medicines, giving pamphlets that these are the medications you can be on. No, do not do that. If you're on any kind of medications, there are drug interactions with the medicines that are being prescribed for COVID. So please have a check if the medicines that you are already taking have or do not have an interaction with the COVID medicines that you'll be taking. Secondly, if you are not on any kind of medication, or even if you are not on any kind even if you do not have any kind of disease or comorbidity, still you should not take any medication without consultation, because you may be allergic to it, you may have side effects, you may face severe problems. Always consult a doctor before taking any kind of medications, and especially the medications that are being prescribed for COVID, because we are also prescribing steroids, we are also prescribing Dexona. These kind of medications make your sugar levels go high. That is a side effect, and it's normal, it's okay. So please, please, please spend on yourself, and it's all right to spend a $500 than to be dead and lie in a coffin somewhere or lie on a pyre somewhere. Okay, so on this note, I'll take your leave. Please mention in the comment section if you need information on anything else. If you need more videos, if you want me to make more videos, I'll be live again. Till then, goodbye, take care, and hopefully we'll all come out of this and we'll all see each other on the other side of this. Thank you.